Good morning. I'm Alina Carnahan, and I will be the moderator for today's media availability. Spanish interpretation of this media availability is on ATXN3. To start, Austin Public Health Director Stephanie Hayden will first say a few words, followed by Dr. Mark Escott, Interim Austin Travis County Health Authority, then Austin Public Health's Chief Epidemiologist Janet Pichette, and then we'll open it up to the pool reporter who will ask questions from the media. Stephanie, over to you.
Good morning. Today I want to just remind everyone about our testing availability. We opened up a site September 22nd in the Metropolis community. That neighborhood, as well as all other neighborhoods, have morning, evening, and weekend testing availability. Please go to our website and either sign up there, or you can call our nurse line and schedule that appointment, or you can do a walk-up at those facilities. We also have in-home testing. The other thing I want to talk about as things begin to reopen and we have more capacity at restaurants and individuals are moving about more, it is going to be very important that we watch our behavior. We have recognized during COVID-19, it is important for us to continue to have great health hygiene, as well as social distancing and wearing your face covering. We really cannot emphasize the importance for us. We know that those are things that are proven. The science supports that these have helped us as a community to stay strong. So please watch your behavior and be that important person for someone else to really want to mimic your behavior that you're doing. Lastly, flu season. October 1, we're here. And we cannot emphasize the importance of getting your flu vaccine. It is so important for you to take care of that as our community. It is a proven vaccine that we know will work. It will really help us as a community. And that is something you can do for yourself as an individual, but also for your family. We just don't know what type of flu season that we will have. And so between flu and COVID, we're really trying to keep down the number of individuals that end up in our hospital so we don't overwhelm our systems. Thank you.
Thanks, Stephanie. And, I want to say that, I think the news from early this morning regarding the President and First Lady indicates to us and demonstrates that COVID-19 can touch anyone. If the President of the United States can be touched by it, it can touch anyone. It also demonstrates the importance of having layers of protection in our community. That's the testing, it's the case investigation and contact tracing, but also it's the masking and the social distancing and the personal hygiene. We have to make sure that we are being careful, not only in the workplace, not only when we're at grocery stores or at restaurants, but in our personal lives, with our friends and family. Looking well, not having knowledge of being COVID positive is not enough protection. We have to continue the social distancing. We have to continue the masking. We have to continue the hand hygiene if we're going to be successful at limiting the spread of disease. Our data from this week is the same as our data from last week. It indicates to us that transmission is happening during social gatherings. It doesn't matter if you're a college student, a high school student, or a member of the public. The transmission is happening in the same way. When people are face-to-face, and generally when they're not masked and not socially distanced. As long as we can continue those protective actions, we can continue to keep our schools open, we can continue to keep businesses open, but it's going to continue to be important for all of us to be committed to those protective measures.
And I'll just add on to what Dr. Escott has to say, and that is the best prevention for COVID-19 and for the flu will be doing your hand washing, avoiding touching your face, making sure that you socially distance and stay 6 feet away from other people. And most importantly, if you're sick, you need to stay home and you need to isolate yourself from people who are well so that you don't spread disease to them. Again, another reminder, it is flu season and flu season has started. We are getting anecdotal information that flu is in our community. We have providers that will be providing us weekly reports starting this week, and we will be getting that information and preparing reports related to that. But it will be all the more important for you to make sure that you get your flu shot to give you any kind of added protection from flu, and so that your immune system is at the best, in the place where it is the best that it can be.
Thank you, Janet. Now to our pool reporter, Betty Cross from CBS Austin, who will be asking media questions.
Thanks for having me. And yeah, the president and the first lady are clearly the big news of the day, but also UT football. So since others are asking about the president, I'll ask about UT football. So with UT football set for Saturday, what is the status of campus cases? And do you know the results of the rapid testing for those wanting to attend the game?
So I'll just add that we did meet with UT this morning. We meet with them every Friday morning. They're working on doing the rapid testing. You probably will need to reach out to UT to get specific result information related to the rapid testing of those individuals who will be going to tomorrow's game. We have been following up with UT. They've been an extension of Austin Public Health and been doing the case investigation and contact tracing of UT students. There have been some indications that there were some clusters associated with the University of Texas UTEP game. And more importantly, there have been a lot of lines of transmission that have been associated with not just the game itself, but with those social gatherings that have been associated. So people who are gathering to watch the game in some setting are actually transmitting disease in that to each other.
Our staff, our environmental health staff, attended the last UT game, and they provided some information back to UT. And we're able to meet with them this week to provide additional support. We know that the health department, as well as the University of Texas Athletic Department and UT Dale Med, which is handling all of the testing and contact tracing, we have to be a team where it's very seamless, that we are working together. And so as we receive more information, it allows us to make the necessary improvements. But as individuals are testing positive, they are provided the information for them to quarantine for the 14 days.
On what you were just saying, talking about what was the health impact in terms of cases of the first UT football game, and is there any correlation between the game and cases rising?
There's always an impact when you put a large number of individuals together in a setting. So whether it is a UT football game that they are attending, or if it's a gathering outside of the arena where they are watching the game together, what we have noticed is that most of our positivity is as a result of some type of social gathering. So whether it is a party that individuals have attended together, and even like with schools, we're even noticing that with the extracurricular. And so those are things that our contact case investigation has really shown us, is that the social gathering has really led to more positive cases in our community.
This is a question from KXAN, and it goes back to the President and the First Lady. How concerned are you for President Trump's COVID-19 recovery, given his age of 74, his sex male, and his weight 244 pounds? And how have Austin residents with similar profiles fared?
So, Betty, I'll start by answering that. You know, when we look at statistics like hospitalization rates and case fatality rates, it's on a heterogeneous population. So there are going to be many differences amongst people who are 70 to 79. So it makes it difficult to use statistics to determine how someone's individual risk is, what someone's individual risk is going to be from COVID-19. I will say for the data that we analyzed from March and April, individuals aged 70 to 79 had a hospitalization rate of 37.1% and a case fatality rate of 12.9%. And that was for individuals who were living outside of a nursing home. When we look at the president's known risk factors, such as obesity, that's going to increase his risk compared to someone who doesn't have any risk factors. Some of the national data sets suggest that the mortality risk for somebody, a 74-year-old with a history of obesity, may be between 3 and 11%. But we also have to remember that the president has unlimited access to health care. He has unlimited physician resources, and certainly we expect that his risk will be on the lower end of that estimation.
The other thing that I would like to add, I totally agree with Dr. Escott. I think it's going to be, we are concerned for the president. We are concerned with any individual that is 74 years old across our city, even younger, that may test positive with COVID-19. As Dr. Escott stated, the president has the best access to health care in the nation. He will be able to receive health care that the average 74-year-old will not be able to receive. When we look at it from an equity perspective, most 74-year-olds will not have that access. The majority of 74-year-olds may primarily have a Medicare benefit. Some may have an additional type of benefit. When we look at uninsured rate in Austin and Travis County, people that are 65 years old do have the federal benefit of insurance. However, individuals that are 18 through 64, we know that 23% of folks living in Austin and Travis County are uninsured. And so when you don't have that access, it does lead to higher negative outcomes for you.
Thank you very much. The next question is from Austonia. On Tuesday, APH Director Hayden told council members that the Federal CARES Act funding will run out on December 30th. Will Austin Public Health be able to continue providing testing, contact tracing, and other pandemic-era services in 2021 if Congress does not approve additional relief funding?
Public health is a number one priority for the city of Austin and Travis County. In the event we no longer have the federal funding, currently we do receive some state funding to be able to provide some of these services. However, we will work with our elected officials and our city management to determine exactly what we will need to take us through the calendar year of next year. We have sent them a rough estimate of to maintain at the level that we have at our highest point of surge budget. We've provided that to them, and so they are aware of our needs. And so we will continue to provide the level of services that we have thus far.
The next question from KVUE goes back to President Trump and the First Lady, but it's a little bit different, so it's certainly not redundant. President Trump and the First Lady both tested positive for COVID-19 last night. What was your reaction to this? In terms of contact tracing, President Trump was around a lot of large gatherings, and officials are trying to figure out who he came in contact with. What will the process look like in general going forward as group gatherings begin to grow larger again?
I'll start by saying that I think the first reaction was concern for the president and the first lady. COVID-19 can impact severely many people, and the president in particular is at higher risk than others for complications, including hospitalization and death. But we also know from the epidemiological evaluations of our cases, as well as the data from around the country, that transmission happens when protective measures are not followed. And, again, it's important that we have layers of protection. In the case of the White House, we don't have the details on the protocols there. I understand that everyone is screened before interacting with the president. But screening itself is not enough. Screening is not a perfect science. There's going to be false positives. There's going to be false negatives. That's one layer of protection. The next layer of protection is social distancing. The next layer of protection is masking. The next layer of protection is that personal hygiene, the frequent washing of hands, and the avoidance of touching one's face. Success in decreasing transmission depends on multiple layers. You simply cannot rely on a single layer of protection and expect to prevent disease transmission.
And I'll also add that, I think this just highlights the example of how you may have the availability of masking and personal protective equipment available to you, but that you still are susceptible to develop disease if you're not, as Dr. Escott said, using those layers of protection to protect yourself and your loved ones. So it's again very important that people continue to use those prevention measures, especially if they're going to be placing themselves in positions where they have interactions with other people. From the contact tracing standpoint, I imagine, I have no idea how the state of Maryland or Washington, D.C. In the National Capital Region will follow up on these particular cases related to contact tracing. But I imagine they will follow the CDC guidance, but that would be a specific question for them specifically. But ideally, when we do contact tracing, we try to identify anybody who has had contact with that ill individual within 6 feet for at least a 15-minute period or cumulative 15-minute period, even if they are masked. And we would follow those people up, and we would place those people into quarantine and make sure they are monitoring their symptoms and are getting the appropriate testing to rule out any disease transmission.
I'll also just add to Janet's comments that one benefit in terms of case investigation and contact tracing as it pertains to the President and First Lady is that they're going to have an exhaustive list of individuals who were in contact with the President. They're going to have more specifics than usual on the duration of that contact. So I would imagine they would be able to do an effective job at contact tracing. One of the challenges that we've had locally and that we've seen across the country is having that detailed information, having individuals being willing to share that information so that we can protect the rest of the community as well as notify their contacts. And again, I can't stress enough the importance of that cooperation for those who do test positive. That is essential for us to really limit the spread and ensure that those that have been exposed are informed.
The next question is from Co-op Radio. With no testing at any AISD school where many school children could be asymptomatic, the responsibility for testing falls on families that may be unable and or unwilling to test. Even if all students and family members test on their own, how is that data to be collected and successfully used to make educated decisions?
So I'll start by saying that we have plenty of testing available for anyone who wants to get tested through our austintexas.gov/COVID-19 website. In addition to the drive-through testing, we have neighborhood testing. We have the ability to test people in their home if they can't get out. And it's important that parents understand those signs and symptoms so that if their child develops any of them, that they get that child tested and they keep them at home. We've recommended to the superintendents that they encourage students who are participating in extracurricular activities where masking and social distancing are not possible or practical to consider that proactive testing so that they can have better surveillance because they are at higher risk. We've also recommended that the school districts provide notification to parents of those students that that individual is at higher risk for transmission and that the household is then at higher risk for transmission and that those student athletes or band members or cheerleaders mask and social distance within the household to prevent or decrease the likelihood of transmission within that household.
And I'll go ahead and add that, there's definitely two-way communication between Austin Public Health and the school districts. Each school has a point of contact who we communicate directly with. We have developed the school task force or school cluster strike team to follow up on individuals who may be sick in school setting. And we're monitoring that and having those communications, providing guidance and technical assistance on those cases as they are presented to us. So there is that dialogue that's happening on a daily basis. Anyhow, I just lost my train of thought there for a second. Sorry. I'll just leave it there.
The other thing I just want to maybe chime in is that I agree with Dr. Escott and Janet Pichette as well. The relationships that we've established at the superintendent level with those individuals, but then also the relationship that our education strike team has established with the staff that are working in epidemiology staff, it's going to be important for them, and they've done so. They will reach out to us. We've established an email address, and they're able to send us emails, and they're able to call our nursing hotline. And so with that type of support, we feel confident that we will receive the information. Testing is available, as Dr. Escott stated, and so it is important for the individuals to either call the nurse line and request that an individual come to their home, and we'll be willing to come and test them at home because that may be a better setting for them to have their person tested at home.
And Betty, let me just add one final thing. And again, I think it's critical for parents to understand transmission is happening in social events. That means our parents have to be responsible and not host parties. They have to ensure that they are providing good advice to their children. I think, again, the president's infection with COVID-19 should resonate across our community that transmission can happen in anyone. And if we want to keep our children safe, if we want to keep our teachers safe, if we want to keep our community safe, we have to avoid those social gatherings where people are not wearing masks and where people are not social distance.
Thank you so much. From Univision, when do you think we will be moving to stage 2? There's the million-dollar question. And what's your recommendation for parents during Halloween?
So I'll start by addressing the stage 2. I hope it's soon, but again, rather than hope, I'd rather encourage folks to continue those protective actions that will get us there. This is not magic. It's not just going to happen that we get to stage 2. It's going to happen because people are committed. It's going to happen because people are avoiding those social gatherings. It's going to happen because people are wearing their masking and their social distancing. That's how we're going to get there. How long that road is depends on us as a community in the engagement in that mission. It could be soon, it could be next week, it could be the following week, or we could see a bounce. Again, the stage that we're at, we've been oscillating for weeks now. Back in June and July, we went from where we are now to ICUs being at capacity within 3 weeks. So at this stage, it's important to remember that it could go either way. But if we continue those protective efforts, we have a much better shot of going in a positive direction and getting us to stage 2.
Does anyone want to tackle the second part of that question, which was Halloween?
Yes, I will address the question about Halloween. The department has reviewed the CDC's guidelines for Halloween that they have issued. We have also reviewed some additional information that we've received from other major cities. And so we are putting together some guidance information that we're going to provide to the public. And we will be putting that information on our website. It is going to be important. I know that this is a huge transition for most folks. And even as we even make our way through the year for the rest of the holidays, there's going to be concerns about the gatherings that we typically do. And so I encourage individuals to think about a new tradition for Halloween. I don't encourage the gathering, but if it's all about behavior. So individuals have to make the best choice for them and their families. And so if there are new things that you want to create within your family, I've seen people be really creative and, instead of going door to door, collecting candy. Maybe they want to hide the candy in the backyard and do something unique for, their children and their families. But you just really have to create things where you are going to be safe, that you are going to be able to social distance and ensure you have your face covering on at all time. And lastly, the document that we will generate will show you some things that are lower risk and medium risk and higher risk. In the event individuals do go out and get candy, please don't allow the students, the children to eat the candy immediately. Have them to put the candy aside for a day and then have access to the candy.
Betty, I'll just add to that, and I'll tell you what the Escott family is going to do this Halloween. The Escott family is going to dress up, and if we can find a COVID piñata, we're going to hang it and fill it with candy and take a whack at it. It's not something we normally do, but certainly it's a safer way to have that same sort of spirit and do it in a safe way.
If you find that COVID pinata, you've got to like share that with all of us. I think maybe you'll run on them.
I may have to make one myself.
All right, so the next question is from the Austin American-Statesman. I know Mayor Steve Adler hinted this week toward possible changes to gathering limitations, especially gatherings outdoors, as the 7-day moving average for new hospitalizations continues to decrease. How soon might we see that 7-day moving average decrease to 10? And once it does, will that mean larger gatherings would be immediately allowed? Will that 10 new hospitalizations average allow for any other changes to social distancing orders, like bars reopening and that type of thing?
So, Betty, we're looking at the data right now, and we certainly are having discussions about what our local data as well as published research is telling us about gatherings. I think there is growing evidence that outdoor gatherings are going to be safer settings than indoor. And certainly, if we get to a stage 2 territory, that we would consider opening things up in terms of those gatherings. I think it's likely that we would increase outdoor gathering size first, and then followed by indoor gatherings. Our current guidance for gatherings at stage 2 is a gathering limitation of 25. So we may modify that. We certainly may modify that in terms of outdoor settings because it does seem apparent that disease is not transmitted as easily in that type of setting. So I hope that we're going to have some updates in the next week or 2 weeks regarding those outdoor gatherings.
Thanks. Is there no one else? Okay, then I'll go on to the next one. All right, with in-person learning about to expand, do you have any concerns about the use of school buses? And do you think it's still the right time to bring 25% of students back into classrooms?
Betty, again, the guidance that our team created is a 52-page document with recommendations for our school districts. Our school districts have done a great job in following those guidelines as much as they can. They've implemented the masking and the distancing. In some circumstances, physical barriers were necessary. And I think that while we've seen some cases from school students and some faculty, we have not had efficient disease transmission in the school setting. Again, the evidence that we have at this stage is that transmission is primarily happening in extracurricular activities and social events. So as AISD opens up, it's going to be critical that the superintendent and principals stress the importance of that responsibility, not only when the students are in the classroom, but when they're outside the classroom as well. In relation to school buses, if the students are masked and distanced, it should help to protect transmission in that setting. Certainly we've encouraged ventilation, so air conditioning and window opening would be encouraged in the circumstance of a school bus, help improve the airflow in the school buses and help prevent disease transmission. But the best method by far in decreasing the risk of transmission is for all parents to be committed to keeping their child at home if they have any symptoms at all of COVID-19. And I bring that up because as we enter cold and flu season, there's going to be a lot of other things that are not COVID. People have to assume if there's congestion or runny nose or cough or sore throat or nausea or diarrhea, any of those things or the other symptoms of COVID-19, they have to presume it's COVID-19 until it can be proven that it's not. If we all take that position as parents, then it's going to lead to safer buses and safer schools, and it's going to keep our educators safe as well.
And I would just like to add on to what Dr. Escott was saying is that if you have those symptoms that are sort of non-specific but similar to COVID, it could be flu, it could be related to your allergies, you need to consider yourself infectious until you've been tested and ruled out that it's not COVID. If it's another infectious disease, you need to remain at home until your symptomology resolves or you're fever-free for 24 hours. So as I mentioned in the past, if you're in doubt, go get it, check it out. And that means get a test to determine and rule out COVID-19.
Thank you. The next question is from the Texas Tribune. Some parts of the state, for example, the Waco area, have seen a recent increase in hospitalizations. Is the Austin area seeing more hospitalized coronavirus patients? And/or are you anticipating an increase as we head into the fall?
Betty, our cases are not increasing right now. We've had some oscillations up and down over the past several weeks, but it's relatively flat. Our positivity rate is going down. Looking at our positivity rate, we don't have an update yet for last week, but the data that we have right now is showing that it's lower than it was, under 4% at this stage for last week. We still have data coming in, so that could change, but certainly we don't have an indication that it's getting worse. So I would expect that at least in the short term that we would stay flat or potentially decrease. But again, that can change very quickly if behaviors change. This is absolutely not a message that we can take the masks off and start burning them. The masks have to stay. The distancing has to stay. We have to continue to avoid those social gatherings. But people can be a little more assured that things are improving, and if we stay committed, they'll continue to improve.
KXAN has a follow-up question now about the President and First Lady. There is video showing members of the Trump administration boarding Air Force One and all touching the handrail on their way up, plus turning around and talking to each other without masks. How dangerous is this, and how likely is COVID-19 to spread in this way?
Again, Betty, I think the challenge is that when there's a program in place of testing everybody, then there's the false reassurance that everybody is COVID-free. And that's simply not the case. That's why real protection depends on layers of protection. And I think that because people were not masks, because they were talking to one another within 6 feet face-to-face, it's going to increase the risk of transmission. There's simply not a substitute for those protective actions. Speaking on behalf of the office where I work, people are self-screening. There's temperature checks at the door. There's hand sanitizer at the door. And every single person all day long, every day, is wearing a mask. And if we're communicating with one another, it's from a distance. And that's what we have to do. That's what we have to do until we have herd immunity through vaccine. And if we try to shortcut that, it's going to lead to transmission.
I would say that, the science really supports that when you don't social distance and you're not wearing your face covering, the potential to transmit COVID-19 is greater. So whether you are the President of the United States or you're, an individual average citizen, if you are not taking those precautions and using the things that we know the science has proven works for us, we will see more transmission.
Thank you both. The next question is from KVUE. Is it possible any decrease we see for COVID at this point to be related to a decrease in people not getting tested, not necessarily the virus going away? Or are you taking this into consideration?
We are definitely taking this under consideration. We have noticed that there are fewer individuals that are coming in for testing, but our message remains the same, that even if you are not symptomatic, at this point, we are testing asymptomatic as well as symptomatic individuals at all of our testing sites, because there may be a perception that because I don't have symptoms, but if you have been exposed to an individual that has tested positive for COVID, whether you have the symptoms or not, it's going to be important for you to come in and test. And so we are really emphasizing the importance of getting tested.
And Betty, I'll say that while we've seen some decreases in testing, over the past 6-8 weeks, it's been relatively steady. We're getting results on about 12,000 tests a week into our database, and that's been consistent. One of the reasons why we look at hospitalizations or new admissions to the hospital as one of our key indicators is because it's not going to be related to the testing effort. It's sort of an independent verifier of disease spread in our community. We also look at the positivity, because that's going to be a ratio of positive to total tests. So that's also going to give us an indication. So I think there is a good amount of testing. We certainly want to encourage folks to not avoid getting tested. And I bring that up because we have heard that some groups may be intentionally avoiding detection because of various consequences that they perceive. We need folks to feel free to get tested. We want them to get tested so that we can protect themselves, protect their family members, and other members of their household, as well as the rest of the community.
Thank you. The last question here today, and I know some of y'all had a heart out, so this is probably good news. This is from Co-op Radio, and it's Athens, Georgia was able to keep case numbers among the lowest in the state when the University of Georgia opened, creating one of the nation's coronavirus hotspots. How is the City of Austin and Austin Public Health working to keep this from occurring here?
So we have a great partnership with the University of Texas, the Dell Medical School, and I'm pleased with their efforts at proactive testing. They've done a great job of designing a system that allows for potentially 1,000 students a day to get tested, for their faculty to get tested. And I'm also grateful for the messaging that they're sending across the campus, which talks about individual responsibility. And, I think one of the messages that we want college students to really understand is that while we would prefer that they not interact socially with one another to help decrease transmission amongst them, we really don't want them to have social interactions with people outside of their age group, because that's where the risk is more consequential. That's where we increase the risk of hospitalizations, and we increase the risk of death if they are spreading disease to members of the community outside of their social circle. So we'll continue that messaging with them. We'll continue to work with the University of Texas. And ultimately, I think that the University of Texas has a rich tradition of social responsibility amongst their students. And I'm hopeful and confident that will continue.
And I would just like to add that, anybody who gets tested in the Austin area or in Texas for that matter, if they have a positive result, that will automatically be transmitted to the local health department. It's also a requirement for clinicians, healthcare systems, and school officials to report positive cases to the local health department so that we can intervene and investigate and conduct contact tracing where necessary to break the disease transmission cycle. Not only are we working with the University of Texas, but we have, similar to our school cluster strike team. We have a higher education strike team that's reaching out and working with all schools of higher education in the Austin-Travis County area to make sure that they have a point of contact here at the health department should they need assistance or guidance on cases that may occur at their university.
Well, that is it for us. Thank you all for your time. It's been very helpful.
Thank you, everyone. Before we wrap up, would you all like to give any quick closing remarks?
In closing, I would just like to remind individuals that as we continue to reopen, it is going to be very important for you to be cognizant of your behavior. Ensure that your behavior is continuing to social distance. Hand hygiene is so important. Also, your face coverings. That is so important. I know as things begin to open and it looks like we're at a point where you can stop doing these things, if your behavior changes and you stop doing any of these, the risk of you getting COVID is greater. So continue to do these things. Flu season is here. Please get your flu vaccine. It is so important that you do that for yourself and your family and your loved ones. We continue to have testing available. Please reach out to us and schedule your test.
Well, I'll close by saying, our thoughts are with the President and First Lady, as well as the other members of his staff that have contracted COVID-19 or been exposed, and with the millions of other Americans who've had COVID-19 and the more than 200,000 families who've lost a loved one from COVID-19. This is not over. We have a long road ahead of us. But if we can stay committed to those protective measures, those layers of protection, we will get through this storm. We need to be committed, and in particular, we need to avoid those social interactions where the masks are off and we're not social distanced. We prefer that you not get together with large groups of people. But if you do, wear a mask and social distance. It's going to decrease the risk.
And I would just like to bring up, I know fall is a beautiful time in Central Texas, but with it comes allergy season, cold and flu season, as well as now we have COVID-19. So the best prevention for you and your family is to make sure that you are using those protective measures that both Stephanie and Dr. Escott have mentioned, and wearing your mask when you're outside if you need to go outside, and washing your hands, staying home if you're sick. That's definitely a big one. And making sure that you prepare yourself for the onslaught of all these other conditions like flu and allergies, but make sure you're getting your flu shot and putting yourself in your best healthy position.
That concludes our media availability for today. Thank you so much to Director Stephanie Hayden, Dr. Mark Escott, Chief Epidemiologist Janet Pichette, and to Betty Cross for joining us today.